Hi everyone, I wanted to present a well child visit, which is a 2-month well child visit, who her mom expresses her concern about her funny head. And of course I wanted to put some of this segments of lectures or presentation for the nurse practitioner, pediatric nurse practitioners or students as both pediatric nurse practitioners and practicing, as to how to do a pretty much a comprehensive, detailed history, both subjective and objective. And this one is an easier version, which I took some of this questions actually from my university when I was taking my postgrad. Let's get on with it then. It's a 2-month-old baby who comes in for her well child visit. Mom is concerned about her funny head. The allergies are none. Birth history is 8 pounds, which is 75th percentile. Length is 20.5 inches, which is 75th percentile. Head circumference is 14 inches, which is 90th percentile. And APGAR scores are normal. Passed a newborn hearing screen. Newborn screening results were negative, and oxygen saturation on room air was 98%. Medical history, normal. Family history is non-contributory. Surgical history is also non-contributory. Social history, lives with mom and dad. No other children, no pets, no smokers, and no secondhand smokers are cared for by her parents. Her history, she's exclusively breastfed on demand, at least 8 to 10 times per day for 10 minutes on each breast. And mom takes prenatal vitamins. Mom does not complain of any breast and breastfeeding issues. Elimination history is normal. Sleep history is normal. She sleeps on her back. Current medications include vitamin D3, 400 international units by mouth, because she's exclusively breastfed. And her immunization was the hepatitis B she got at 1 day of age. We'll go on to the subjective history, which is the review of systems. Generally, no significant increase or decrease in weight. The head, eyes, ears, nose, and throat seem to be all negative, except for the head being shaped funny. Cardiac standpoint, it's normal. Respiratory also is pretty normal. Gastrointestinal is normal as well. No vomiting or spitting up. Breastfeeds for about 10 minutes each breast, and she gets fed on demand at least every 3 to 4 hours. A GU standpoint, there's no problem with that. Musculoskeletal, mom states that her fists are still closed and they move well without any problems. Now we go on to the objective data. Of course, you take the vital signs, height, weight, head circumference, and then you compare also from the birth weight as well. General appearance looks really good. Ears, eyes, nose, and throat. If they're normal, just state whatever I've mentioned here, such as the fontanelles are important. And then the tear ducts, the eyes, their positioning, the pupils are equal. Cornea, if they're clear. The ears, also if they're normal, just state that they're normal in like how I did it here. Nose also if it's symmetrical without lesions or deformities, etc. And then look at the teeth. If there's no teeth, a 2-month-old will not have any teeth, and if the mucosa is clear. Objective also should look at the neck, cardiovascular, and respiratory system. And look at the abdomen as well, if they're protuberant, soft, symmetrical, are there any masses, GU, looking at if they have pulses, genital area is clear, and there's no diaper rash at all. For male infant, you can also state if they're circumcised or uncircumcised, and then mention about the extremities as well. You do the Ortolani and Barlow's test. Other objective data are the back and hips. If their spine is straight, there's no tuft and dimpling on the sacral region. That's when you do the Ortolani and Barlow maneuver. Musculoskeletal, their head 45 degrees if they lift it up. Flex their body when they're prone. Hands remain fisted. Dermatological conditions. Psychiatric if they're interacting with their mom. And neurologic, of course, if they're appropriate. After you gather your data, you do your assessment, and my assessment is that she's a 2-month-old baby, comes in for a well child check, overall doing really well. Mom is concerned about the funny head. Reassure her that the head circumference is 38.1 centimeter, which is at the 50th percentile. Generally, you can mention it to mom that head measurement should be half the length of the baby, and it should grow about 1.3 centimeter per month. It should increase about 0.95 centimeter per month until she becomes 6 to 7 months of age. First differential diagnosis is positional plagiocephaly, probably due to the way she sleeps, but there's no evidence of birth trauma. So does she sleep on that side for a long time? How many hours? The other possible one diagnosis is craniosynostosis. She can have an early closure, absence of one or more of her cranial sutures. So the diagnosis can be based on what mom states, that she sleeps more on that side of her head, but more than 2 to 3 hours, and flattening in that area. She has positional plagiocephaly. She does not have any evidence of frontal bossing, anterior displacement of the ipsilateral ear, which are the clinical presentations of this diagnosis. So the other diagnosis can be craniosynostosis, which can also present with occipital flattening. In lambdoid craniosynostosis, the affected head suture is palpable, and the ear is located more inferiorly and posteriorly, so there's no evidence of palpable head sutures. Prescriptions are the immunizations for today, and then advise mom to do counter positioning of the head every 2 hours, allowing the head to remodel. And we'll consider imaging and or helmets in the next couple months if her head does not respond to conservative therapy. For diagnostic testing, monitors cranial symmetry for the first year. Consider head CT if there's a true skull deformity. And there are no imaging studies needed at this time, so she has to return in 4 months for further evaluation. The next thing you need to do is reassure mom as one of the anticipatory guidance. So when the child is awake, do a tummy time or a side position to reduce the flattening. When feeding, encourage parents to hold the baby. Spend less time in infant car seat. Improvement should occur over a 2 to 3 month period. If there's an orthotic cranial molding helmet, therapy may be prescribed. If not, she has to wear it for 23 hours a day for 4 to 6 months, and it can be costly, and make sure that the insurance actually covers it. Newborn health risk anticipatory guidance: washing hands always after diaper changes, limit exposure to people, breastfeeding is encouraged, car safety seats: all babies younger than 2 years old should ride in the rear facing seat. Heat stroke prevention as well. Their back is very important. Assess the living situation and food security, family support. Reassure mom that she will be waking up more at night, placing the baby in her crib during her drowsy time. Safe home environment to prevent burns, drowning, and falls. Don't drink hot liquids. The hottest temperature should not be more than 120 degrees Fahrenheit. Age-appropriate immunizations today. Surveillance of development: social, emotional, communicative, cognitive, and assess her physical development as well. Then screening, what are maternal depression, hearing screen, any referrals that are required, and then ICD-10 codes, patient family education, cultural considerations, and return to clinic in 4 months. These are the guidelines that I use from the American Academy of Pediatrics, CDC, and the AAP's treatment guidelines for craniosynostosis, and these are my references. So thanks for listening, everyone, and I'll see you guys in the next lecture or any travel.